Hi, I'm Dr. Matthew Hicks of Synaptic Integrative Care and Training Institute and the Integrative Psychiatry Review podcast. And I'm here to tell you a little bit about ketamine and answer some of the common questions I get about it. Now, this story begins in the early 1960s when ketamine was developed as an anesthetic drug. It was very quickly found to be effective, and the United Nations eventually listed it as an essential medicine. So you'll see this in hospitals around the world. It's safe to use in adults and even children, and is also used in veterinary medicine, sometimes giving it the reputation as being a horse tranquilizer. But what they found over time was that it also seemed to have these antidepressant effects. So in the early 1990s, the National Institute on Mental Health did a series of studies, which is now known as the infusion model. So the infusion model of ketamine therapy usually involves 6 intravenous infusions over a 2-week period, and then booster sessions at various intervals thereafter. They use a very slow ketamine drip to minimize the dissociative effects of the ketamine. Now, this is an evidence-based and effective model that, in its premise, emphasizes the pharmacologic effects of the ketamine as the primary mechanism of the therapy. Now, we can contrast that to the ketamine-assisted psychotherapy model, which I practice. And in that model, we emphasize that it's ketamine that facilitates an altered state experience, which is the mechanism that enhances psychotherapy. Now, we use this model in various ways out in the real world. Often it involves a prescriber who may or may not do the entire series if they're doing the counseling as well, or a prescriber and a psychotherapist that does an intake visit, some preparation visits, sits with you during the whole ketamine experience, and then has an integration process. Now, this model is not as evidence-based, and that's simply because the clinical trials haven't been done. Doesn't mean it doesn't work. So then what is the ketamine therapy experience like? Now, there are a few biases about ketamine that are important to cover here. One is that it's a party drug or that it's addictive. Now, it is used in the underground in various settings, including parties. And unlike other serotonergic psychedelics, which have this refractory period that give you a physiological limit, such as mushrooms, if you took full doses every day, you would get diminishing returns, diminishing psychedelic experiences with those mushrooms. But with ketamine, that's not the case. You can take it over and over again, and it continues to work. So as a drug of abuse, it can be abused in this way, and in some cases results in damage to the urinary system in those patients. But barring that sort of use, it's actually very, very safe in clinical settings where you have trained clinicians controlling the amount of ketamine that is used. Now, it's also a synthetic drug, and there's sometimes a bias, particularly in the psychedelic world, against synthetic substances. And this is understandable in a world where we have pharmaceutical companies pulling all sorts of schemes, pushing drugs that have all sorts of negative side effects. And it's also a bias that comes from the decades-long war on drugs, where we're told all drugs are bad, and we have things like meth and heroin addiction that are out there. And like I said, ketamine can be abused in this sense, but when it comes to the psychedelic experience that ketamine can induce, it's every bit as mystical as many other psychedelic substances out there. So don't underestimate it. Even in a world where MDMA-assisted therapy or psilocybin-assisted therapy or other psychedelics are fully legalized, there will be times when ketamine may be the best substance to do some deep introspective work with. So I encourage you to consider ketamine assisted psychotherapy as a potential model that may help you in your healing journey, or even ketamine infusion therapy in cases where that might be a better fit. If you have more questions or curiosities on this topic, you can check out my podcast, the Integrative Psychiatry Review, where I've done an episode on various psychedelic treatments, including ketamine, as well as my practice website, which is synaptic.care for the Synaptic Integrative Care and Training Institute, where I'll have more information there for you. So thank you, and I hope you enjoyed.